Hi everyone and welcome to the channel. If you've not been here before, my name's Phil. I've been on a Mounjaro weight loss journey now for around 10 months and during that time I've lost nearly 4 stone. It's not always been plain sailing, but if you want to see how it's going, I do a weekly update on this channel. I'll put a link down in the description below so you can follow along. Now if you're on Mounjaro and you're currently thinking about switching to Wegovy, you're not alone. Whether that's affordability issues, availability issues, or just pure curiosity, or you're thinking about switching to see if it's a better time or a better drug for you, you're not alone. It's probably the most common question in the weight loss community at the moment. Can I switch? Yes is the answer. Is it easy? Pretty much, but there are a few crucial steps you need to follow along the way. Before we look at logistics, we need to quickly address the science. Mounjaro's active ingredient is tirzepatide. What exactly does this mean? Well, it means it's a dual agonist. It targets 2 hormone receptors, GLP-1 receptor and a GIP receptor. Wegovy's active ingredient, semaglutide, is a single GLP-1 agonist. Because they work slightly differently, it means they're not interchangeable and brings us to the main safety point when you are switching. You absolutely cannot overlap these medications, so what you're going to need to do to avoid severe side effects is go through what we call a washout period. Now to do this, it's really simple. What you must do is after taking your last Mounjaro injection, wait 7 days minimum before you take your first Wegovy injection. This then allows the Mounjaros cleared enough from your system to allow a safe transition. And because of this, most providers will recommend you take your first Wegovy jab 7 days after your last Mounjaro jab, which would put you in exactly the same cycle you were on with Mounjaro. But as always, follow your doctor's or provider's medical advice. Now, a common misconception when you're switching from Mounjaro to Wegovy is that you go from dose to dose. That's not true. Mounjaro and Wegovy doses are not like for like. So for example, Wegovy 2.5 milligrams is the highest dose you can go on Wegovy, and that's actually 0.1 milligrams less than the starting dose of 2.5 milligrams for Mounjaro. And because of this, most providers will let you go from the exact dose you're on Mounjaro to the equivalent on Wegovy, based on your Mounjaro history and how well you tolerated that dose. You generally won't need to start on the 0.25 milligrams of Wegovy, which is the beginning base dose for Wegovy. So you'll go on the equivalent dose on the same 7-day cycle that you were on Mounjaro, but now you'll be on the equivalent Wegovy dose and you'll be able to titrate up or move up in dose exactly the same way as you were before if you want to and if your provider lets you. One of the other big questions you get asked around here is the half-life of Mounjaro and Wegovy. Mounjaro is 5 days, Wegovy 7 days. So for all those who are interested, you should get the full cover for 7 days, unlike on day 6 and 7 on Mounjaro, when the effects start to slightly wear off a little. For many, the most compelling reason of switching right now is the cost. With recent price changes, especially in the UK, Mounjaro has become too expensive for a lot of people. So for that reason, Wegovy is becoming the much more cheaper alternative GLP-1 medication for most people. And that is why most are now considering switching to it long term for their weight loss management. But let's talk about results though. Because Mounjaro targets the 2 receptors and Wegovy only the 1, what are the results like? It's not as big as you should think. It's around 2 to 4% difference in overall weight loss as seen across the trials and results and the data that was provided by both companies in the early days. Now I want to emphasize that word average. When you switch, your body is getting used to some new medication. Even if they work similarly, it's going to take some adjustment. Some patients report that it has the exact same effect straight away from day 1, and others say it can take several weeks before they start to see the full effectiveness given them the same suppression and food noise cancellation as Mounjaro was. You might experience a slight slowdown in weight loss, you might experience a slight lack of suppression or food noise, but give it time, be patient, it will come. Stick with it and keep doing the good habits you've already formed in the early days of Mounjaro. Stay consistent and let the medication ramp up in your system. Now Mounjaro and Wegovy share a lot of the same side effects, nausea, headaches, fatigue, those kind of things. But one that does seem specific just to Wegovy and has been nicknamed Wegovy Wind, and you can guess exactly what wind we're talking about, and that is a gassy, bloated flatulence that seems to come with just Wegovy. I've not been aware of anyone mention this kind of side effect on Mounjaro. I'm not saying it doesn't happen, but it does seem to be more susceptible for Wegovy than it does with Mounjaro, and Wegovy Wind is the nickname it's been politely given. Now if you do get this, there's always things that you can do. Avoid spicy trigger foods or eat smaller portions, chew your food more, same as a lot of the Mounjaro side effects. Go for a gentle little walk after eating, that can ease the gas, things like that. All common sense, all normal things that you try with Mounjaro for other side effects around there. The sulfur burps are the main one with Mounjaro, and that was one that could be eased by them things too. If it does persist though, speak to your provider or your doctor, and they might be able to give you some more advice, or speak to a pharmacist to get some anti-gas medication over the counter. But the bottom line is switching from Mounjaro to Wegovy is a safe, straightforward and commonly increasing practice, often driven by cost. It requires a 7-day mandatory break or washout period, a dosage adjustment which will be guided by your provider for the equivalent dose, and most of all, patience while your body adapts to the new medication, including keeping up those good habits you've already instilled in yourself from taking Mounjaro. Use that to get you through. Now, if you are switching from Mounjaro to Wegovy, I'd love to hear from you in the comments below. Let me know about your experience. Was it that straightforward as I've just explained there? Was there any additional side effects that we're not aware of? And do you recommend switching from Mounjaro if cost is a factor? And even if it's not, is it a good choice to switch? Don't forget to like this video and subscribe if you're not already for more GLP-1 insights, and hit that notification bell to get notified next time a video goes up. For now though, thanks for watching, and I'll see you in my weekly update.